Can esophageal varices be effectively managed long-term? Imagine facing a condition that has the potential to cause life-threatening bleeding but can be controlled with the right approach. That's what managing esophageal varices is all about. These enlarged veins in the esophagus often develop because of increased pressure in the portal vein, usually caused by liver cirrhosis. While they pose serious risks, effective long-term management is possible with a combination of treatments and careful monitoring. One of the main strategies is endoscopic variceal ligation, or EVL. This procedure involves placing tiny rubber bands around the varices during an endoscopy to cut off blood flow and prevent bleeding. EVL is widely used because it's safe, effective, and has fewer complications than older methods. It's usually done in multiple sessions to remove all the varices, and patients need regular follow-up endoscopies to check for recurrence. Studies show that EVL significantly lowers the chance of rebleeding, making it a cornerstone of long-term care. Alongside EVL, medications called non-selective beta blockers are often prescribed. Drugs like propranolol or nadolol help reduce pressure in the portal vein, which lessens the risk of bleeding. These medications are used both to prevent initial bleeding and to protect against rebleeding after treatment. Combining medication with endoscopic therapy provides a stronger shield against complications. Even after successful treatment, varices can come back because the underlying cause, which is often portal hypertension, usually persists. That's why ongoing surveillance is vital. Regular endoscopies allow doctors to detect new or recurring varices early. Sometimes, additional EVL sessions are needed to keep the veins under control. Addressing the root problem is also crucial. Managing the liver disease causing portal hypertension can slow or halt its progression. This might include antiviral treatments for hepatitis, lifestyle changes like quitting alcohol, and managing liver fibrosis. In advanced cases where the liver damage is severe, a liver transplant might be the only definitive solution. In some situations where standard treatments aren't enough, more advanced procedures like transjugular intrahepatic portosystemic shunt, or TIPS, can be considered. TIPS involves creating a channel within the liver to divert blood flow and reduce pressure in the portal vein, helping prevent bleeding. It's important to remember that despite these effective options, some patients may still experience recurrent bleeding. About 10 to 20% might not respond fully to initial treatments, which underscores the need for personalized care and close follow-up. Managing esophageal varices is a long-term process that requires teamwork between patients and healthcare providers. In summary, yes, esophageal varices can be managed effectively over the long term. Combining endoscopic procedures, medications to lower portal pressure, regular checkups, and addressing the underlying liver condition can help prevent serious bleeding episodes. However, because the risk of recurrence remains, ongoing vigilance and sometimes additional interventions are essential. Always consult with healthcare professionals to develop a tailored plan suited to individual needs, as each case can vary widely.